You may make a you may make a diagnosis of acute gastroenteritis with dehydration, and you may advise them ORS, and you may teach them using visual aid how to how to make the ORS. And this is a Muslim patient who doesn't know anything except Urdu, and you're telling them take the ORS packet, cut it, mix it with water, boiled water, and give it to the baby, and the baby will become healthy. And your starting picture is a dehydrated baby. But the Urdu speaking Muslim patient is reading it from left to right. So be careful about that. So I'm just exaggerating. You know the story from before, but what I'm trying to say is there are many times you will say do MRI, CT, QRST panel, this panel, that panel. He comes from a situation where he has no money, or he's got family issues, or we tell them no, you stop smoking. The ATT will say no, you stop smoking, then the child's asthma will get better. Meaning, I don't know how to stop smoking. Neither does both of us know, because we are doctors. We are clinicians. We never learned that. So I think there's a lot of medicine outside medicine, and if you really want to make them a good doctor, your job is important. Of course, I believe, since you community medicine, I believe that community medicine, managing director sir, community medicine should not exist, according to me. I think every one of us as doctors should be community specialists, public health specialists. But the problem is because that department exists, it's not my job, ComMed. So everybody gets dumped on ComMed. It is my job. So when you look at it, a good doctor also worries about the community and about where this patient comes from. So maybe in future you can integrate community medicine. They can run the emergency. So that's just one task shifting which will happen.
Thank you. Good afternoon, sir. I'm Dr. Bhavna from Department of Psychiatry. I don't know about the other branch competencies, but when I see psychiatric competencies, what we teach for UGs, I feel that it is almost like what we teach for our postgraduates. There is so much of competencies involved, like sexual disorders, everything. So, don't you think that undergraduates are also the faculty who's teaching undergraduates are burdened and
So I'll just tell you what the process was. Unfortunately, the if you look which department has got the highest number of competencies, huh? Anatomy, medicine also. So I think it's anatomy, medicine, and I think pediatrics is not bad. We also got it. Now you ask me why anatomy competencies are so long, because there was a tough woman on the NMC at that time. She was professor of anatomy in Maulana Azad, if I remember, and she was driving the process. And I was asked not to infiltrate that batch. I was told to sit with biochemistry. So I sat with biochemistry and I instigated, why are you teaching this? Yeah, what? I don't know. Why don't you teach me something related to diabetes? Teach me biochemistry, which I'll apply. So unfortunately, the problem is specialists, psychiatrists like you develop the curriculum for psychiatry, not me. That is the problem. The problem is that psychiatrist said he has to graduate, he must know everything about psychiatry. That is why when the patient comes alcoholic liver disease, I don't know how to tell him to stop drinking alcohol, because I've got so many competencies in psychiatry. So you have identified something very right. If you want, you take those competencies. Do you have certifiable competencies in psychiatry? So maybe you should focus only on those. How long is your posting? 2 weeks, let's say 2 weeks, maybe 4 weeks, I don't know. So in those 2 weeks, you only focus on the competencies which are certifiable. Because technically speaking, the student can go to court and said, you assess me outside the competencies. So my suggestion is, you're absolutely right. The clarity in undergraduate, postgraduate, we in pediatrics it was worse. You had MBBS students, you had DCH students, diploma, and you had MD students. Now, like Rao sir, you have DM in red blood cell, DM in white blood cell, all those cells they've created DMs. So now what do you ask each level is not clear because nobody's looked at it overall. You're absolutely right. My suggestion is focus on your certifiable competencies. You don't have to teach everything else. They will learn. Any case, you're part of medicine, no? Then medicine person will give you one question or two questions in theory. He is not going to give you a case. Commonest case I find in pediatrics today, I don't know about you all, the commonest patient I'm finding in pediatrics today is a child between 5 years to 18 years who is on the cell phone watching TV, got stomach pain, headache on weekdays, early morning, unable to go to school, and coming back. Don't laugh. On Friday during my OPD, 50% of the children I saw, I referred to our child psychiatry unit. Our child psychiatry unit is overwhelmed. They're seeing so many patients. I do not know whether you're seeing it here in Tumkur. We're having hell. It's good to know. Remember, nice to know and all that funny. I don't know which is no. So good to know is not what you're in. You must know certain things, focus on that. Everything else will follow.
That is, when you were doing this whole process, for a CBME